Hi, everyone. My name is Chris Sprague from Persimmon Health. I am a serial entrepreneur working on healthcare technology that helps more people access better quality of care. This podcast is for the movement of innovators, entrepreneurs, intrapreneurs, and thought leaders that are advancing the American healthcare system through digital health. In this podcast, we highlight real stories of innovators and enablers of digital health, their opportunities, challenges, and learnings for innovation. We'll cover topics such as startup building and fundraising, entrepreneurship, emerging technologies, and big ideas to transform healthcare. We invite you to participate in this community, share your stories, and accelerate the movement. Thank you. We have an awesome pod. Enjoy.
Hello, digital health community. Today we're asking WTF is up with health tech by speaking with one of the most prominent voices on the future of health innovation, Jessica DaMassa. Jessica hosts the WTF Health podcast, which stands for What's the Future? Health. Jessica interviews the who's who of healthcare innovation, researching and analyzing new advances, needs, and trends. Jessica has also produced over 200 episodes analyzing digital health tech and funding news with Matthew Holt in Health in 2.00 podcast. And today we're going to talk about the trends in healthcare and her advice to entrepreneurs on how to clearly identify, explain, and highlight what's unique about their startups or new products. Jessica, welcome to the pod. We are huge fans and thrilled to have you.
Yeah.
Can you please unbutcher my introduction by telling our audience?
Oh my God, what did you do? The guy set the bar really high. I'm more nervous than ever, Chris. I'm not used to being a guest, so it's
You're on the other side, yes.
Yeah, but thank you so much. It's such a pleasure to be here. I'm really excited to talk to you.
Yes, so let's dive right in to where you are in WTF Health, where you have a front row seat to innovation, to the future of health innovation. Can you take a moment to talk about WTF Health, its inspiration, its mission, and the types of innovators and innovations you look to feature?
Yeah, thank you for the question. The thing with WTF Health, so it's we're WTF am I right now, right? So it's the innovators that I choose to focus on are the people who are trying to drive change in healthcare using technology or new business models or new payment models, kind of rethinking all the things in healthcare that are broken. And so I focus on talking to entrepreneurs of all different kinds of startups, seed funded, all the way up to those that have gone public, and I'm still watching on the public market because we're rooting for them. And then the incumbent innovators, so the folks who are incumbent organizations like pharma companies or health plans or provider systems who are trying to Sherpa this stuff in and make it a part of the way that healthcare operates. And then the last group of people I talk to predominantly are investors. So whether they're institutional investors at those kind of incumbent organizations, or they're venture capitalists, or we saw private equity investors come into the fold through COVID. It's those are the people that I'm talking to kind of get a sense of, what's going on with the technology, what's the plan for changing the way that healthcare is broken in all the ways. How is it going in terms of uptake, whether it's, pilots or actual clients or, whatever. And then, when the investors, it's what are they saying that's, kind of hot, or what are they throwing more money at in terms of where they see the greatest opportunity for scaling up and being the next big thing that gets, really baked into the healthcare system in a meaningful way.
Right. And you talk about these groups of people that are at the same time rethinking healthcare and what it can and should be. And I know there's some trends of healthcare and health tech. And maybe we could talk about those and really perhaps as a reference point, COVID. In the heart of COVID, A16Z posted excitedly about the great unlock of healthcare, saying that a transformation of healthcare that would have taken decades is unfolding right before our eyes right now in an accelerated pace. And since then, it really feels like we're on almost the other side, fingers crossed, of COVID and calibrating on what is right now. At a macro level, what has changed in the digital health industry during COVID, and where have we calibrated since?
I think the biggest thing that has changed was that nobody, broadly speaking, lots of patients, lots of providers, like health systems writ large, those people had really no idea what the use case at a big level for digital health, remote patient monitoring, virtual care was. And so I think that to me was the big thing that really changed, that all of a sudden everybody kind of knew what a video visit was. And they may or may not have known to call it telehealth or whatever, but all of a sudden people knew what that was and that it was available to them. And so I think that we saw, like it really exposed who had the capability to deliver care in that way, what was going to happen in terms of payment and reimbursement for those types of services. And it's like all of that stuff got addressed. And at the same time, it was like a big opportunity to test the do patients really like this? Is it convenient? Do providers like to give care? Where are the opportunities? Where are the challenges? What do we do? So I think the obvious big thing that changed is that I really think that it put our category of virtual care, RPM and digital health into a bigger conversation that was much broader than this niche little healthcare innovation population that had really, we feel like we've been talking about it forever. We're starting to turn some of the incumbents and the investors and stuff onto this space, but it's like that just changed the conversation in a really big way, in a macro level, and particularly I think with patients. So that's one of the big changes. The other thing that I think that has kind of happened since is that there was kind of a movement from this focus on, health tech being, strictly driven by the pandemic and the need to set up ability to see patients. So moving from a virtual care or remote patient monitoring, digital health focus of like health tech into now, I feel like, couple years through COVID, we're starting to look at like other things that are happening. And so I feel like the way that health tech has traditionally been selling itself or organized or whatever has also started to evolve. So one of the things I see as a big macro trend in terms of the way that that has changed is like this whole idea of like becoming an infrastructure play. Like I feel like before COVID, there really weren't a lot of infrastructure plays. But then as COVID happened and people needed to stand up telehealth, it was like that was, companies like Wheel or Amwell started to position themselves as like an infrastructure play. We're selling infrastructure. We don't even want our label on it. You make it yours. And this is how we do. And I think there are other things that have come, into play in that same way. I mean, there's patient communications platforms that are selling as infrastructure. They don't want to have the relationship with patient. They just want to enable the incumbent to be able to do that. Or those that are doing, like different types of pricing or like different types of care navigation or like those, the digital front door type startups, the chatbots, all of those is like they started to sell as infrastructure. And I think that that's really an interesting way to think about scaling up the companies that are in our sector that are technology dominant, but where incumbents were starting to have an issue with like, well, we want to have the relationship with our patients. We want them to know that it's us, hospital X. And so I think that was something that really changed a lot in my mind, was hearing more and more people refer to their company as being infrastructure and selling in a way that let the incumbent still have that relationship, the brand name, all that stuff, but where it was their technology that was driving what was actually changing in terms of the integration of technology and the better, ability to manage and track patients and help them, get into the healthcare system the right way, or even just like to facilitate those, telehealth visits that needed to happen. The other thing that I will say, I think that happened a lot in COVID is we started to, because everybody made investments into virtual care, we started to see this whole idea of omni-channel. Like that was a word of the year for me. Like last year, I feel like everybody at Health last year that was like on stage over and over, omni-channel. And it was like, what had happened then in my mind was it was like, okay, no longer are we just using telehealth video visits or whatever as a way to, just get through this emergency. Now it's like, okay, I have this other way to sell. And like suddenly it became like, Chris, you might be too young for this, but like when the internet first started and people were shopping online, there was like a real like hesitance of like, I don't know if I can put my credit card in this. How can I do that? Now you can like literally buy something with your face on a phone, like, and you don't even think anything about it. It's like, but this was kind of the thing where it's like, as retailers started to adopt that, okay, we can maybe start to sell online. It never became a question of like, are we going to lose our bricks and mortar? It became how do we have an omni-channel model where we're selling along all of these different places? And I think that what I feel like we started to see in a lot of the big healthcare organizations. And I'm not just talking about like health systems or health plans, but even like those retail health, Walmart, Walgreens, some of those CVS, starting to look at like, how do we build an omni-channel model out that is like, some things are going to be done virtually, or we're going to hope they are, or we're at least going to have the option in a real and meaningful way. Not like, oh, it's a nice to have, but it's buried like, 7 pages deep in your like member portal in your plan, but in like a meaningful way where this is a front and center way to engage patients. And then I think it's like they're trying to figure out, how do you blend that together with like an on-site visit or an in-person visit? And what does that look like? And so I think too, we started to see a lot of startups pop up in that space where they were like omni-channel enablement companies. So like those companies that do blood draws mobile, or like they send a nurse out to do something a little more complicated as far as a wellness check or whatever and report back. And so I feel like there were a number of different companies that kind of popped up in that space and got some pretty big funding because they enable that virtual visit to go a little bit further without requiring somebody to go into the hospital or into the doctor's office. So that whole idea of omnichannel, I feel like, was like the other big thing that happens like in the last couple of years through COVID. So infrastructure, omnichannel. I'm like the buzzword girl right now.
I'm actually glad you brought both of those up because I think these, and you mentioned these retail providers, like for example, the Walmarts, the Walgreens, the CVS clinics, the Chem Meds, that are augmenting what they already have with additional physical patient-facing models. And a lot of the other things you mentioned, like, mobile nursing or home care or blood draws, I think is a part of one of those meta-level trends that was forced by COVID, like this decentralization of healthcare, or I think what A16Z also called the unbundling of the hospital into care delivery that moves towards these retail-like pharmacies, community-based, virtual, at home. Now that COVID is past us, do you think that cat is out of the bag forever? Like the hospital is forever unbundled and decentralization is here to stay?
That's a great question. No, I don't. I think that there's still a lot of work to be done. Like, so like that unbundling to me is like the creation of these other channels, right? So I'm saying omni-channel, and it's like we've got these variety of channels to reach people and to bring them in and whatever. I think that there's in some places, the cat's out of the bag in the sense that people had to invest in that infrastructure. So there's like capital investment in some of this stuff. But the thing that I feel like has not caught up with it yet, where I can't in my mind say that the cat is necessarily out of the bag, is that I feel like what I've been hearing from folks is that it's like the workflow processes that need to support that are just not in place. And what I've gathered from is particularly on the telehealth side, it's like, it was just kind of like the first thing I feel like that everybody's looking to as like one of those things, like that would be, you have in-person, or the other channel, or the other way the hospital gets unbundled is by using the virtual visit, is what's going to happen with the emergency regulations that were passed to allow care to be delivered across state lines by different practitioners, not require state licensing to practice wherever the video visit is being held, and then also the reimbursement at parity. So I feel like for me, it's like, and just the sentiment I get is that everybody's like cautiously optimistic that there will be some changes that don't bring us back to a pre-COVID state, but that may not be as generous as what's happened as a result of the emergency regulations. But I think everybody's it seems to me like I'm reluctant to say that the cat's out of the bag completely until we see what happens with that, because I feel like there's that hold up on changing workflows. Or I had this great interview with Roger Jansen, who's the Chief Digital Health and Innovation Officer at Michigan State University Healthcare, so our healthcare system. And he's saying that like what's been interesting about like the video visits that they used to have during COVID, I mean, their levels of virtual visits have dropped 70%, despite the fact that you can often see a doctor faster, right, virtually than if you have to come in the office. I'm like, what do you think that's all about? I'm trying to do the same thing you're doing. Like, is the cat out of the bag or what? He said that he thinks the big issue was a behavior change thing. The people who are answering the phone don't think to offer the virtual visit anymore because they just assume everybody wants to come in. It's a behavior change thing. It's a workflow thing. We've never even like train these folks to even ask, like, do you want to make that appointment virtually and come in on this day, or do you want to come in person and wait until there? And it's like that's such a basic thing, but just some of these basic things are not in place. And I feel like there's this waiting that's kind of happening to see what happens with some of those temporary regulations and what some of the decisions are that are made in terms, or particularly around reimbursement. Because how good of a channel is that omni-channel model for you if one of your channels is not generating the type of revenue that you think it should?
Yeah, absolutely. And I think I want to unpack those policy trends a little bit, maybe in a second. But just talking about the decentralization of healthcare and whether that's here to stay, it reminds me of the other movement that happened during COVID, which is the move to remote work. And in particular, I work in remote product engineering, and I feel like that cat is absolutely out of the bag. But I think it is probably much different than healthcare in that the workflows and tools for remote work have always been there, right? GitLab and many other companies have been remote first for ages. So it's just everyone else getting a taste of that life. And then in remote development, you also, the end consumers are not part of your workday versus in healthcare, they are the centerpiece of the workday. So I think
I would love to see it decentralized. Like, I love that. I mean, I think the more ways that you can provide for people to access healthcare, the better. Like, I love the direct to consumer piece. I love the, virtual visit. I love the virtual visit plus an on-site thing. I love it. I love the home care that has a lot of potential. I think that there's so many different ways to augment what currently exists. And I hope that if like COVID taught us anything, it's that it's like, there are a lot of different ways to do these models. And I think like, even if reimbursement doesn't stay at parity, it's like, how can you rethink now that you've practiced it this way and you had reimbursement for basically, it's like what people always gripe about with digital health or health tech, we just digitized what was happening in person and now, made it on video. Like it was the same thing. And that's true even from a reimbursement standpoint, right? But it's like when that goes away, even though we have the practice using the technology, can we figure out now how that we've started doing it? We just digitize exactly what we were doing. Can we get really creative in terms of inventing different types of maybe payment models, or what is this used for? And is it different? Maybe instead of I don't know. It is like, could reimbursement somehow evolve along that way to support the creation of these new channels, not just digitize the old channels because we were in an emergency and needed to. And I hope that happens. And I don't know what exactly enables that other than some like really creative mind and some really powerful people and the American Telehealth Association lobbying for. I have no idea. Like, I hope all of us can like rally around that and kind of push for this. Maybe it's the innovators, the entrepreneurs who bring this stuff in. I was going to say too, Chris, I was thinking about this as we were talking. I'm like, the other thing I really do feel like is that there's the time is right to have this conversation about rethinking what's possible in the payment model, but still playing within like the rules of what's going on. And I think that was another thing that I felt like a COVID, where are we now? Like a new trend that has kind of emerged is there are all these people all of a sudden who are like asking all these questions about the payment model and who are actually in like real and meaningful ways, kind of like, yeah, you know what? We don't need to be a large self-insured employer and use a traditional PBM, one of the big three. We can use like a navigator company like a Rightway or a Transcarent and have them negotiate our pharmacy benefits for us. And you know what I mean? And start to eliminate expense. So I think people are starting to rethink that. There are a couple of different, startup PBMs that have really emerged and are starting to gain traction. And it's like, that's always been the black box of like healthcare costs. And so it's like, there have been other things, I think, even within the plan world, we always talk about value-based care, but there's like value-based care light. It's like what I like to call it, where it's like some of the startup companies, the health tech companies are even doing this, where it's like they're taking on risk for certain things against certain KPIs, and they're starting to bundle things together. And like you're starting to see a little bit more of a movement away from the per member per month, which is like basically our like fee for service version. And it's like people are just challenging that in different ways. And so I think the time is right to start thinking about like on the value-based care thing, it's like, maybe I don't have to go full, all in, all risk, but what does that look like if I dial that back? And how far do I have to dial it back where I'm still making a meaningful impact and things are still tied together? I'm reducing costs, but I don't feel like I've taken on too much risk and I'm in over my head. But I feel like that's something that's really new, where people are really starting to take a look at novel ways of innovating within the payment model. And I think that is really neat. I think even the direct to consumer movement we're seeing, or even some of those retail players who are coming, everybody's waiting for like Amazon to do something with, prime health insurance. They're building that vertical stack. Like, what are they going to do? You know what I mean? The $10 video visit, who knows? I mean, and maybe, and there are a lot of CEOs of health tech companies, and I think also quite a few incumbents that I feel like I've spoken with across the ecosystem, plan provider, pharma, who are like, you know what, like the direct to consumer thing does have legs for certain things. And it's like starting to become like a little bit more adopted, So it's like, I do think that too is a unique payment model, because everybody's always like, well, who would go on here and pay, $30 and not go through their insurance and get this done? I have a high deductible health plan. I'm like, I'm never going to reach that deductible. I have a sinus infection. I'm going to do a virtual visit using, one of the myriad online pharmacy type businesses that are there.
Absolutely.
See the doctor, get the prescription called in, and then go and pick it up. You know what I mean? What is that going to do on my deductible? It's not going to do anything.
Yeah, no, I love that you're highlighting these emerging business models within healthcare. And I think healthcare is one of those complicated industries where the end user is oftentimes not the customer per se, or the person who's paying the bill. I think
I have to say this right here. This is the coolest thing I've heard about this. So I had the opportunity. Sorry, I'm like such a gossip. I'm like, I talk to all these people. I have the best job in the whole world. I seriously do. So I was talking to Ziritano, who's the CEO of Row, and he has this coined a phrase for this: direct to patient care model. And so I had this at the ATA annual meeting. We had a fireside chat talking about direct to patient care model. And it was like, I got to ask him some of those, challenging questions, like, because people want to say, oh, well, it's only for young people, or it's only for, this or that. And it's like, patients will never pay for their care. And his whole thesis around this is like, maybe not now, but it's like, there are a growing number, like their business is growing, and they're not the only one that is in that space. There's a number that are in that space where they're delivering, the online pharmacy, virtual pharmacy business. And it's like, that is really poised to grow, I think. And I do think he's onto something. And his whole thing was like, we know how slow healthcare moves. This is not like, in 2 years, everybody's gonna be buying stuff online. But at the same time, it's like, there's going to be some steady growth in this pathway. And maybe in 10 years, like that is one of those channels in that omni-channel model that's thriving.
Right. Yeah, and I think there's this emerging mantra that's the right way to validate a consumer-focused digital health product anyways now. And I think maybe the hesitance from some of these plans and even providers is from their experience working with these new products in the RPM and the chronic care startup days. And they've started going to direct to consumer first, not as the ultimate business model, but as the proof that patients will actually use their invention or their program, right? And that's because a lot of these providers and payers have been burned by the promise of tech that will improve outcomes and bottom lines for some that no patient wanted to use. And that truth is that, gosh, patients don't wake up every day wanting to be engaged. So if you're asking them to use or wear something or do something different, you better be sure that it's organic to their lifestyle and easy to use. And I think entrepreneurs are starting to, by default, de-risk this part first, right?
Yeah.
Or else nobody believes them. And at the end of the day, interventions don't matter if consumers won't receive them.
Absolutely. Yeah, absolutely. I agree with you.
You talked about Amazon. You've talked about infrastructure. And there are now, not just the retails getting in, but the tech titans that are entering in healthcare. It seems like everyone has a healthcare play, between Amazon building this mystery vertical stack that may or may not go external, Apple, Google, Microsoft as examples. Gosh, which of these are interesting to you? They're kind of like platforms as a service. Maybe they're competitors. And are they scary for incumbents or startups?
What do I hear or what do I think?
I guess both. Yeah.
So this is what's funny is like I hear more often than not that these are not scary for incumbents. Like I hear, and the reason, especially if you talk to people who have been in health tech for a while, the Matthew Holts of the world, or some of these folks who have followed this space for a long time, they know that a lot of these companies they've made multiple runs at healthcare, and then have like retreated and like, like regrouped and then took another one. And so it's like, I think there's a lot of skepticism. I feel like among maybe those of us who were not around for that initial first wave of health tech, we might feel like, I think I fall in the more optimistic, like, and maybe it's just I'm really rooting for the incumbents to like have some kind of competition and be forced to like, you know what I mean, to innovate and adopt some of these things that would make healthcare, reduce admin expense so that we can just drop the overall healthcare, improve their processes, digitize them, collect data, look at data, figure out how to improve a workflow faster than not, but do it in a way that's obviously, safe and de-risked and whatever. But you know what I mean? Like, I just feel like there are definitely some things that those organizations have the ability to do because they are used to working at a faster pace. They are used to taking a little bit more risk. They even, took a big risk, and a lot of them took the big risk and failed in the healthcare the first time they went. And now, they're regrouping again. It's like, okay, this didn't work. We're adjusting. We're trying something else. I mean, it's so interesting that it's like you have like Amazon Care shuts down, but it's like then the big news also is like Amazon acquires One Medical. And it's like, but wait a minute. Like, okay, we didn't like how this model was shaping up. We're going to just pivot right now and do this. I mean, but I think that kind of thinking is where the incumbents are going to get challenged. And I think they should be afraid of that. And they should also be afraid of the fact that those businesses have an ability to engage consumers with experiences that they love, products that they love, technology that is ambient and seamless and flowing, the ability to like collect data that they can't even. Yeah. And I don't even want to talk about the fax machine thing, Chris. I don't even want to talk about the unstructured clinical notes that we have no idea what's going on. You know what I mean? Yeah. There's so much of that. And it's like, I think that there's the threat there for them to me is that you have these tech titans that just have the ability to think about changing this stuff. They're not afraid to take risks. They've got so much money. And it's like they have this real, I think, ability to maybe reimagine the healthcare experience because of the fact that they're not in it.
Right.
In a way that I feel like an incumbent, it's like, I used to work for a Blues plan and I was on the innovation team. And that's actually the part of the WTF Health founding story, like came out of this. And in the end, in a weird way, because I used to have to go to these meetings and try to tell people who had been working their jobs, doing a great job, but keeping their job was like to improve the status quo and continue to make like revenue, that they were like skyrocketing revenue with a nice, happy year-over-year percentage increase. It's hard to want to go and like go through the upheaval of, integrating something new and taking on the expense. And we don't even know if it's going to work. And we've never done it this way. And all of my performance metrics as an employee are tied to my goals from last year, which is like a 2% increase in this, not like a let's stand something up new and like, completely recreate the payment model. Like I didn't sign up for that. You know what I'm saying? So I think that having when I was in that space and in the plan that I was at, there's a real interest in innovation, but there's a lot of fear for it. And it's what's ironic in all of this. And it's like part of why I started my show. It's like there is a real need for information about what this technology is, how it could be deployed, what that payment model around it could look like, what the engagement model with patients and providers and whoever else needs to be involved could look like. And it's like, that's what I try to do is like introduce this stuff to people in a very like, I like to say, like, someone once called me the Oprah of health tech because I'm just energetic and pretty excited about everything. And I really don't want to try I want to ask hard questions like, okay, well, could this really work? How do you scale it up? Or what's the payment model around this? Is that really going to work? Is people really pay for this? But it's like, I want to make sure that like, I'm asking the hard questions, but in a way where it's like, it's all information speaking and kind of educational in the sense that it's like, it's a safe place to learn about the things that maybe you don't quite understand, how they're being deployed and how it all works. So that like, whether you are in an incumbent organization or another entrepreneur, or just somebody who's innovation curious, you have the ability to see this stuff and like, and maybe have your mind open, maybe be able to think about, you have that innovation mindset that you need where you're not afraid to hear this stuff and then perhaps go and give it a try. And if you're in an incumbent, take on the tech companies that might be coming your way.
Yeah, no, there's so much baggage that stops these large incumbents from actually challenging their own models of thinking and doing things. And, it's been shown time and again that, that may work or delay for some time, but at some point, if you don't cannibalize your own business, somebody is going to do it for you. And now we have these tech titans and retails from, other industries coming into the market, and it's really, pressing the issue, right? It's like change now, or these people are going to change it for you.
And I think the retailers are going to put a lot of pressure on that. I mean, like, and the thing that's cool though about that is it's like, it's like the retailers they're partnering with incumbents. So it's like, it's not like these guys are leaving them in the dust. It's like, okay, like Walmart and their United Healthcare deal, 10 years on that. Like, that's a pretty significant deal. That's a decade. I mean, and so that's interesting to me because it's like all of a sudden you've got like this Walmart, United Healthcare. So it's like you've got the retailer, you've got the plan, obviously Optum RX, you've got the PVM, and like what does that look like? That looks just like CVS, Aetna, Caremark, right? So it's like, all of a sudden. So it's like, I mean, I think that's going to be one of those like, forget this like tech titan versus incumbent thing. Is like I want to watch like these retailer plus plan vertically integrated like care payment model PBM behemoths, like two giants just going at it. Like that's going to be cool to see.
Right.
I mean, think about the pricing power, the number of lives, the number of places that those four brand like touch. You know what I mean? Like, it's crazy.
No, I think that is absolutely that competitive advantage that a lot of people are worried about. And then, the other one you talked about is, people already use our technology advantage from the Apples and the Googles and such, and Amazon, of course. It's going to be fascinating to see how it plays out. But people are still investing very much in these startups that are neither incumbents nor titans from different industries. So let's talk a little bit about funding. Rock Health reported that digital health funding doubled for 2 years straight, I think peaking at $29 billion last year. But in the first half of this year, we're down to $10 billion. And we've had a lot of inflection points as a planet in tech and healthcare in particular, from COVID to almost post-COVID, the war in Ukraine, and this now inflation and potential recession. How have these events or others impacted healthcare investment, and where are we at right now?
I'll give you the gossip of what I'm hearing. So it depends where you're at very much. So, I mean, I think the general sentiment, which I feel like the general sentiment is like, we were so like excited. I feel like during COVID, and it was like, literally, it was like how people must have felt like when prohibition went into effect. It was like, the party is like over. There's like a black cloud over us now. It was like the sky is falling. That's it. Things are over. And I think that might be true in some ways, but I think that's I feel like it's a little bit overblown. Like, I really don't think that this is like we had our moment and that's it. You'll never hear from us again. Things will never be fun. And what I'm hearing from a lot of people, generally speaking, both on the entrepreneurial side and on the investor side, is that there's a lot of money out there. Like, people are like kind of looking for stuff to fund. And there's a lot of investors who are taking like this, what can I get a good deal on right now? Kind of approach to like funding. And so I think like, we already are, we're not seeing the types of valuations and rounds that we were seeing before. I think there's a lot of good in that, because some of that I think was very overblown. And and so I think that that's a good thing. I don't necessarily feel like this doomsday effect on that. I actually feel like this was kind of the correction that we needed so that the bubble that everybody talks about doesn't burst. Like, I think that what we're seeing, or at least what I feel like we've been seeing, at least through most of 2022, is there's been a pullback, but it's like there's still stuff happening. There's still deals that are, and it's like, I think I'm getting a sense from some of the startups. It's like I keep hearing it's more difficult to find to get an A than it is to get a later round, depending on, obviously your market traction and what your reputation is, who your other investors are. And I'm hearing that like there's like a mixed bag on seed funding. Like, it just seems like investors are hungry to put stuff somewhere, but it's like, and there are deals happening, but it's like, it seems like there's kind of like it's like when you have to go shopping, and it's like always for me, clothes shopping, and it's like you have money to burn and you really want to buy and you just don't like anything. It's kind of like that. I feel like it's more like that right now than it is anything. Because I think too that there was the artificial thing, not only just like the valuation piece, but I think that there was just, the obvious trend for a lot of investors that were new to health tech during COVID. The obvious thing to invest in was virtual care and mental health. It was like all of a sudden, and think about the number of companies in those types of spaces, remote patient monitoring, digital, where it's like, this was the obvious thing. Like, everybody's stuck at home. Oh my God, I'm investing. And so it's like, this category is going to blow up. And like, there was a particular point in the pandemic while we're all waiting for the vaccine in some manner of shutdown, depending on where you were in the country. It's like, that's where a lot of this happened. Those don't know that Robinhood stuff, the meme stocks, you remember that? The good old days of the pandemic. And it's like, we were like getting used to being at home, right? We had baked our banana bread and had like moved on to other hobbies. So I think that like what we're seeing now, I think is like that some of these investors that were new to health tech, I think we sucked them in for life and they're in, but they're kind of, I think, doing that learning of like, okay, I knew that this was big because this was totally an in the moment trend. I still believe in this category, but like, what else is there? How do we help, this omni-channel enablers or the value-based care enablers, those types of companies that are now going to have to do the infrastructure plays, do the jobs of filling in the cracks and knitting together the virtual channels and the virtual plus on-site, the at home, the with the hospital, with the doctor's office, like all of that glue that needs to fill in the infrastructure, all that. I think that's where like people are starting to try to figure out what that looks like. And I don't think we necessarily knew what that was before, but I feel like that's kind of like one of the things that has slowed down investment right now, in the sense that it's like I feel like there's just still kind of like in some ways a learning curve with a lot of the investors that we had jumped into the space before COVID that are sticking around. And then I think there's nothing wrong with the quality of startups out there. I just think we've kind of taken a second to figure out, like, okay, we did all this stuff, like now what?
Yeah, recalibration and a rewriting of the thesis. Word. Yeah, I think in 2021, if you had anything, semi-interesting, then it was pretty much a given that you would get a follow-on funding round. And so less pressure to, let's say, make a sustainable business or prove out that your thing really improves outcomes or has value. But now it's like,
everybody became a mental health company. That was like my joke for a while. I'm like, there was some business. I'm like, they did mental health. Like, since when? Like, everybody's doing mental health. I'm like, I think I might be a mental health startup right now. Like, where's my $50 million seed round? Like, you know what I mean? But I think too, it's like, what's interesting about that is that, like, what you just said made me think. I think another reason we're not like seeing so much deal flow popping right now is that like this health tech space was not very big. It's just not. And all of it, like you just said, like, oh, people got their big rounds. So it's like, okay, like they're still like working on the scale up plan for that run. Right. They've got runway. So a lot of them, like, they don't need another round right now. And if it doesn't make sense, why would you raise if you're going to get a down round? Wait that out, especially if you're funded, that you got funding in the last year or so and you're still scaling up and you've got a lot of cash in the bank to help you do that. Why would we see more deal flow? I mean, I don't know how many health tech companies there are out there, but I felt like everybody I knew got a funding. That's my Oprah moment. Like, you get a funding round and you get a funding round. And, oh my God, you just do 3 funding rounds in 1 year? What? Like, crazy. Yeah. Then there were multiple companies that did that. I know, I had them on my show. I'm like, how are you?
Yeah, your microphone is the magic wand, right? It's the funding.
I know, right? Yeah, that's how it works. I wish. I'm like, I wish.
Yeah, and maybe it's those companies that are kind of stuck in the middle and they never got to raise their big round, but they were planning on it. And of course, startups within healthcare take much longer to prove out than, as you mentioned, in startups in other industries. So it's like, okay, now we have to be patient or go back to school and what it means to try to be default alive until we prove out or funding returns. How about the other side? So the end of life of a company, not end of life, beginning of a new life. So acquisitions. And yeah, I mean, what have been the trends for acquisition categories? I mean, I guess both through COVID and then now recently.
It's interesting. Like, everybody said this year, and I was one of them. I was like, this is going to be the year of the acquisition. And I don't even think that we've begun to really even scratch the surface. Like, I think that this is where it's like, depending on how far you got with product market fit, client engagement, revenue, like proving out your revenue model, like depending on how you're doing scaling wise, it's like we're starting to see, right, layoffs and, it's people who are trying to take steps to keep the company going. But I think there's going to come a point where some of these startups, they don't work for whatever reason. And I do think we're going to see more M&A. And I'm not the only person who thinks this. I've heard this from quite a number of people who are investors. And, it's like, it doesn't, there are still, though, there are great companies who are going to acquire them. And I actually think that we're going to see a lot of like shuffling together of, health tech startups. I feel like, I just talked to Headspace Health, and they just acquired, I'm going to blank on their name right now, but they do like mental health. It's not Smile. It's sort of an S. I'm so sorry. I'm like blanking on the name of this, but they do like, they have a mental health self-care app that is culturally relevant content. So whether it's like LGBTQ or very diversity focused, but Headspace was like, they've got this great content. This is their second acquisition this year of a smaller company that had a very specific niche solution. So it's like that question of like, I think you're going to see a lot of like those, the whole point solution. Right. Remember the Wall Street Journal article, and then everybody is now like, oh, point solution platforms is the way to, like, that's just like, I don't know. It was like, there is a point there. And I do think that we're going to see a lot of, the mergers and acquisitions are going to build more of these platforms, or you're going to see them be something like what Headspace has done, where they're filling in, parts of their own business with acquisitions of their acquisitions this year. With that was that company that just I mentioned that does the culturally relevant self-care and mental health content. And the other one was one that was just focused on self-care and sleep. It's like they just don't have those modules in their program, and so they're going to continue to build out and make sensible acquisitions. And there are a number of businesses that have already made acquisitions this year to fill things out. Signify Health, everybody's darling right now. A couple acquisitions this year to round out what they had. And and it's interesting, how we're seeing that happen, and then what's getting acquired. I feel like I said, point solutions that fit into something bigger. So if you are like a self-care or sleep app, you go into a bigger mental health solution. Or it could be like smaller telehealth companies getting acquired by something bigger that needs a telehealth infrastructure. Or, seeing a lot of provider groups get acquired by somebody that needs more providers. Or I think like in those tech companies that it's like they're Availity, and I like always blank on the other company, like the one that got acquired. It was terrible. I'm like, yeah, you're right. Like the end of life, like they're like dead to me. I'm like, you got acquired. I don't even know who you are anymore. But they acquired a company that really does like a middle ground type tech thing between them and a health plan to fill in that gap. They're doing it better than Availity was able to do it. Why buy it, or why build it when you can buy it and really get like a company that knows what they're doing, that's proven their mettle in the market, has its own client base? Perfect. This is a great acquisition. So I think that's what we're going to see, is a lot of these bigger startups that are very well funded, older, have a proven revenue model. I think we're going to start to see them kind of pick up some of these smaller startups that just didn't have a chance to scale yet, may have a great business, just we haven't seen them be able to like have the time, the money, the capital to prove out their model for one reason or another. We're going to start to see them fit into, this much bigger offering. So the platforming out of like literally everything.
Right. And gosh, mental health, of course, was forced into the spotlight through COVID. But then at the same time, it seems like consumers met them at that moment, those startups and solutions, wellness apps, etc. Are there any other changes or patterns that you've noticed in consumer adoption or readiness for new healthcare technology or modalities because of the pandemic? And for example, I was around when Google tried their Vault the first time around. And the thing is, people just didn't care enough about their health or view technology as a solution to anything health oriented. And, so it completely failed the first time. No one cares about having their, at the time, health data in one place because they didn't know how it could possibly impact or trust Google. Do you think any of those, inhibitions have changed in terms of consumer adoption or trust in technology?
That's tough, because I feel like there's been like, particularly with Facebook, I feel like that actually like it kind of went the other way, or there's like a little bit more distrust. I don't know. I see that in that space. And I'm trying to think if there's anything that I really feel like has gained more traction as a result of COVID, like in terms of utilization. You know what?
Peloton. But yeah, they're on the other side.
Yeah. You know what I mean? Like, oh God, all of those, the fitness mirrors. I remember there was one week we were covering the deals of the week, and it was like literally there was like three different fitness mirror companies that got funding. It was like a total of something like $80 million in funding for fitness mirrors. I'm like, how does this even happen? Like that's a category that didn't even exist. So I think like I feel like we are kind of past that part, but I feel like the remote patient monitoring space in
Hmm.
one way or another, I feel like I don't know, people are really hot on that right now. I don't know how hot consumers are with that, but from a lot of the health system people in particular, that's like a key thing to them. And it's like I get this whole
Right.
sense, that health moving into the home. I do feel like
Hmm.
that's
Hmm.
become more of a thing. If like from an ideological shift, it may not be like a change in consumer adoption in terms of health tech, but where care delivered, like looking at the home as a place of care. Like we never did that before, and now we do. Or like looking at your phone as a place to deliver care. Like that became, that change as you mentioned with virtual care. And I think that that's that ancillary thing around that. I don't know if that's just being pushed by, folks that obviously want a little bit further reach into the home to get some
Right.
different kind of
Right.
data to come back, and if consumers are really reacting to it in that way or not. I mean, jury's out for me on that, but that would be the one I think that I would say that I feel like I've always
Hmm.
been skeptical of that category, but I feel like more so like now post COVID, I feel like I
Right.
keep hearing a
Right.
lot more talk about that.
Yeah, absolutely. Because yeah, I mean that was the only way to take assessments safely, right, for some period of time. And yeah, no, I think RPM is an interesting one where the promise is so great because physicians can know if there's an exacerbation or a problem, even without you coming into the hospital. But at the same time, that's another category where, well, yes, but consumers actually have to wear the thing, right? They have to agree to something that they don't really inherently want, which is to be monitored. And during, like, for chronic care management, all of these companies sprung up purely to remind people to go ahead and enter their weight, to put on the blood pressure cuff, because it just feels so inorganic to people to be wearing those. And a lot of the startups that we've talked to that seem to have something really interesting going are either, of course, trying to make the devices that they have as easy to wear or transparent as possible, or even AI chips on patches. We've talked to a startup company, or just ambient. So sensors put around you in the home, but nothing to wear at all. No phone call to make to remind you to put something on or to hop on a scale. I think those companies are going to be super interesting because I think the benefits can be clear, but again, patients need to comply
I'm
with
so
coding.
skeptical of this
Yeah.
space. I just
Mm-hmm.
like it's just but like I said, I keep hearing about it, and I'm like,
Mm-hmm.
okay, like maybe because so much, this health in the home thing is a real movement. Like we're seeing the retailers push there too, right? I mean, the Signify acquisition.
Mm-hmm.
So I mean, I you want to see that happen, but like I'm like you. It's like I don't know. I don't wear a watch, not an Apple Watch. I'm
Right.
not doing the Aura ring. I have very
Mm-hmm.
tiny fingers. Like, what are you
Mm-hmm.
going to do? And then people point to like, oh well, those smart speakers, that's a way, that's a way. I read this article
Right.
and I can't remember which one it was, if it was Alexa or if it was Siri, but like you learn within the
Mm-hmm.
first 15 minutes of you having that speaker, whatever commands you do in that first 15 minutes, it's like that's 90% of the commands. I mean, it was like 80 or 90% of the commands you will ever use that speaker for. Like you don't learn a lot of
Right.
new tricks. Think about it. It's like, what's the weather? Play this music. Put it on Spotify. But that's like the repertoire of tricks kind of stops after a point and doesn't, I guess, grow
Right.
very well. And that's something that it's like it's just there in your room, right? Like I don't know. So interesting.
Mm-hmm.
I don't know,
Mm-hmm.
that space is just for me.
Yeah. Yeah. No,
I'm gonna get
I think
angry
so.
emails from RTM companies. It's like, go ahead, I'll have you on. You can explain to me why it's great. I'll listen. I'm just not sold.
Right. Right. And it may not end up being the end consumer that wants the thing, but it could be their kids, right? That want to know that mom or dad is healthy, or if there's a problem, right? Make sure that somebody is on it. And taking care of them. And I've talked to a couple startup companies where that is their whole go-to-market, right? We're not trying to go after, people in home care, but we're trying to go after their kids, right? And offering them this way to know, like this whole flipped relationship from childhood, right? That know they're okay from afar. Um, but yeah, I think it's going to be fascinating. Certainly, none of them have been proven out. Um, you've talked a little bit about policies and policy changes that enabled all these new business models during COVID and may take them back. What are some of those policies that you're watching for, in terms of enabling or disabling business models?
The ones I mentioned before are the ones that just are,
Mhm.
top of mind. It's, what happens with telehealth with care delivery or state
Right.
lines, what happens with reimbursement around that. What's going to happen with Roe versus Wade's overturning? You know what I mean? Like, how's that
Yeah.
going to policy around that going to impact data sharing? Because there was a
Right.
great, I had a guest on one episode of my shows who's like a HIPAA privacy expert, and her name is Devin McGraw, and she explained she worked for years in HIPAA during both the Obama administration and the beginning of the Trump era, and she was explaining because everybody, oh my data is protected because of HIPAA. Well, not if law enforcement can request it. So this is going to be a
Mhm.
policy thing that we might see play out on a state level, but the implications for that for a health tech startup is just like what's going to count as some of the
Mhm.
information that could potentially be used in a court case that proves that a woman was pregnant and then all of a sudden was not pregnant and got an abortion. And and so think about like what kind of data that
Mhm.
could include. It could include everything from like data from an online pharmacy that shows that there, was a pregnancy test or prenatal vitamins or something, or you know what I mean? Or it could be
Mhm.
a period tracking app or like a number of different things where they can pull data and that could be used. And as Devin put it beautifully, weaponized, because it can be used in a court of law. But I think her whole point, and you guys need to watch this because I'm not a policy expert and I'm just pointing this out, but it's like there's a lot of different implications depending on what ends up happening around that could affect the way
Mhm.
that data is shared and the responsibility that a health tech company would have to comply with the law. And also, but how do you do that and protect your patients, and how do you let your patients or your members or whomever your users know that if that data is requested because of for a lawful reason, that they have to comply. There's a lot of stuff around that. So it's like, I don't know, those are the big ones that I feel like are
Mhm.
just kind of being talked about right now. I'm sure I'm missing something, but it's like those are the ones that have kind of piqued my interest.
Right. And we've talked a lot about these inflection points and changes in healthcare. But on the flip side, Jeff Bezos shared advice with his portfolio startups that his secret is to focus on the things that don't change about your business. And I'm curious, what are the things that don't change or haven't or you don't think are going to change soon within healthcare?
Uh, that's hard. What doesn't change in healthcare? I mean, I think the payment model, we got a long way to go before the payment model is going to
Right.
change. So I think that like, anything that helps, beef up the fee for service model that is like,
Right.
really not ever going to go anywhere. I think, yeah, value based care is growing. I understand, but it's like, that's still
Mhm.
like the majority of the way that healthcare makes its money. So that does not change. So figure out how to get yourself into that. And then I
Right.
think like some of the other things that trying to think of a good one, like a zinger on this one. I think that like people will always want to go in person somewhere.
Okay.
And so I
Mhm.
do think that like, and we're seeing this in the sense that there's a lot of virtual first primary care
Yep.
companies that offer like a side of mental health, and they're operating on their own EMR system in a value-based care design, that are starting to take that virtual and build like in-person centers. Like Crossover Health has confirmation centers, or you have like an
Mhm.
in-person,
Mhm.
a small office space or some sort of space in a retailer, but there's also the telehealth that complements that. So I think like though, like there will always be a need to have to go and physically see somebody, and maybe that will change to somebody coming to see you, but there is still going to always be that need for human to human contact at one point. So I do think that like you can't say, okay, we're going to completely move to a virtual care kind of, that's just impossible. I always think too, that's,
Right.
what's not going to change. This is awful, but like how people like try to navigate how consumers try to navigate their healthcare benefits. So I like think
Yeah.
there's always going to be like room for like improvement on like
Mhm.
the IT
Mhm.
side, the tech side, the data side of it's like how do I know where to go, or it fits into my plan? How do I know what plan to pick this year? How do I sort through all of this? Is my doctor in there? Like the provider directory issues that are out there. So it's like I think
Yeah.
that's always the stuff that's never gonna change in healthcare. Doctors
Until it's a part of your Amazon Prime, right?
maybe.
Okay. So that was Jeff Bezos's advice. But speaking of startup advice, I believe you have a lot to add as someone who curates startups and innovation trends they're a part of and interviews these entrepreneurs. I know you help entrepreneurs and startups on how to build their own brands. How should entrepreneurs explain their ideas, and especially when talking to someone like you that doesn't know them intimately, or an investor or a potential customer, and you just need to click off the bat?
I have like two really great pieces of advice. It's like ditch your jargon. Like ditch the like high in the sky. Like, will we deliver the right care at the right time in the right place? Are you an app? Like, I don't even understand what
Right,
you like
right,
what
right,
do you
right.
do. Like, give me like a disease area. Like, I have no idea what you're even talking about. So it's like I think that there's like this need to like kind of bring some of the language that well, we're trying to, you know, completely revolutionize healthcare by. It's like, okay, just cut the fluffy sensationalism out of it, and just, I always say, this is the second piece of my advice: tell me what you do, so that if I was trying to explain this to my mom, like, she's
Mm-hmm.
not in health tech. She's not, I mean, she's not an elderly person. She's like, she's that consumer that's like headed toward Medicare, not there yet. But it's like, how would she understand this? Like, she's got, you know what I mean?
Right.
Would she understand what you're doing with, like, explain it? And like, even something complicated, not necessarily even consumer facing, but if you're like one of these companies that's doing all sorts of cool stuff with data, it's like, some of these like a Ribbon Health or a Komodo Health, or like some of these
Mm-hmm.
that are doing like really cool, like amazing stuff with AI and like predictive analytics and things like that, or some of the clinical trial companies that are helping diversify clinical trials by helping curate
Right.
larger audience and decentralize that whole model,
Mm-hmm.
but also use AI to find people who are rare disease and bring them all together, whatever. It's like, how do you explain that to her so that she gets that stuff? Because that's like, if you can figure out how to do that, people will understand your business, and you have a really strong jumping off point to continue to tell your story. And you can get into all the ways that matters and the big pie in the sky visions, which are beautiful. But it's like, to open with that, like, I think that that's a mistake that I often see a lot of startups do, is just try to to talk really big picture, real high level, over conceptualize and overuse jargon that like the normal people won't understand.
Got it. Got it. And you discussed earlier about Headspace making this acquisition of a company that kind of contextualizes mental health, culturally contextualizes. And it turns out that, okay, this is one of their modules that Headspace just acquired into their portfolio of things they offer. How should entrepreneurs think about what they are, in terms of, are they just a feature, or are they a full standalone product, or are they going to be a platform themselves?
That's a tough one, because you have to really think about this, and it's like,
Hmm.
it's like, yeah, are you a feature in somebody else's thing, or are you a standalone company? And it's like, and I think it's interesting because, like, you mentioned the chronic condition startup days.
Hmm.
It's like the
Yeah.
Livongo, Omada, Vita, Verta, One Drop, like arms race of like, what are they going to add to platform out? It's like, what's going to be next? Who's going to acquire like Hinge or Sword and add the MSK thing? And it's like, Hinge and Sword are still there. Like, they ended up not being that, So it's like, that was, everybody expected that to become part of a platform, to be a feature in a much larger offering, and it didn't. I feel though, like, you have to, like, I mean, I think you have to just kind of be really aware of what's going on in the space, and what the players who are a little bit bigger than you are doing, and also what your buyers are saying back to you about what they want. So it's like, if that whole thing is like, we don't want another point solution, or if they don't see the value of having a point solution that does X, because it could easily be integrated with a bunch of other stuff, I think you need to start to take that feedback, and if you keep getting that over and over again, maybe think about what it is that your business really is, and what you need to do to either make yourself more of a standalone,
Right.
what kind of value you need to be adding, or whether or not you do kind of start to think of yourself as maybe a business that has a successful exit being acquired by somebody.
Yep. Yep. And so some entrepreneurs are like good at figuring out what they are right away. Some aren't, and some aren't good at explaining it. Some are great. Some aren't good at focusing on what they can be. But what are some of the traits that you've found of successful entrepreneurs that you've interviewed and have gone on to just, crush it? What do you think some of their patterns are?
um, I feel like they're I'm going to talk about, like, generally speaking, one of the things that where I feel I always like kind of cringe when I hear startup CEOs say this, especially in the early days, and especially if they're having a difficult time like figuring out what they are, and then they start to become everything that every investor that they talk to says that they want to see. So especially if they're trying to raise around, and it's like, well, you're not a platform play, so why don't you become a platform play and come back? Or it's like if they're trying to get new clients, and new clients are like, yeah, this is great, we understand that you're focused on this, but if you had that too, and then it's like all of a sudden they're starting to build new modules and expand, and it's like there's this like it's like it makes me nervous for them, because there's a point where it's like you start to lose what your business does, like that. Remember the old good to great hedgehog concept? Like you start to lose that thing where I feel like some of the more successful entrepreneurs, they might be flexible on a lot of things, but it's like they've got that core kind of vision that I think kind of carries them through in a way where it's like they're okay saying, you know what, I'm not that. I might be open to hearing that I should be that if I keep hearing it over and over, but like right now, like, no, I'm not that. Or it's like, you know, kind of having that steadfast, like, vision, but maybe something that is, you know, flexible on the details, but solid on that long range kind of idea of what it could become, or the outcome or impact that you want to make. The other thing I would say, I think about like entrepreneurs from an interview standpoint, my favorite entrepreneurs when I interview are those that are really candid and are not afraid to say what they think. So this is kind of along the same line. It's like you don't want to, you know, you don't want to say something and offend. And I'm not saying you have to be offensive and sensational, but if you don't like the way that, you know, mental health care is being delivered, and you have some good reason why, or like, and there's a great company, Boulder Care, that does, you know, they have a telehealth program for folks who are opioid addicted to help them get through that. And it's like, you know, she's passionate about the fact that it's like, this is broken and I really want to fix this. And it's like, to be able to say that, I think in a lot of ways, and have that passion, I really feel like there's a lot to be gained in terms of not only the success of that company, but just in an interview, like really feeling like that entrepreneur has not only a beat on what's going on, but is really committed and passionate, like, and fired up at the issues that they're trying to solve, which is like, we know, we've said this, healthcare is a long game. So it's like to keep that fire in your belly over the long term, like you've got to have some fire in your belly. So if it comes across in an interview, I always feel like it's a great trait for an entrepreneur to have.
Yeah, that's interesting. Maybe it takes that passion to not be tempted away from your core vision. And then, yeah, like you said, if you don't focus, you end up building something for everybody, which means it's for nobody at all.
Yeah, and I like when people, like, I'll always ask them, can I ask you about your competition? And like, I'm always fascinated to hear what they'll answer, and I'll always do what they say, because I'm not that kind of person to catch anybody. But it's like, I'm okay answering that, but I don't want to mention people by name. Or it's like, no, I'm tackling these people head on. I am tired of being confused and I'd like, if I hear this again, and you know what I mean? And it's like, I love the diversity of answers on it. I think that's so cool. But I feel like the best thing you can do in that regard is not pretend that you have no idea what else is going on out there, and say like, everybody's doing such a great job. There's room in the market for everybody. Like, there might be, but come on. Let's get real. You're thinking about, you know, what you do to differentiate yourself and how you position yourself. And we need to hear that. That helps us learn.
Yeah, yeah. And I'm sure Matthew Holt, if he gets to talk to them or gets wind of them, holds them accountable to cutting through the BS and betting too.
If not, he'll cut through it for them.
Oh, I know.
He's like the antithesis of me. I'm like, tell me more.
Oh, my goodness. Yeah, no, I had one very fun interaction at Vive with Matthew, where I felt very much on my toes, just trying to explain what we do, which is not complicated, but yeah. Anyway.
It's interesting how easy it is to fall down that Matthew Holt rabbit hole, especially if it's a happy hour. It
was on a rooftop, yeah.
I should warn people, if you ever see him at a happy hour and you have a sense that this is not his first or second, I would steer clear, because it only goes downhill from there.
Right. Oh, man, but love and admire him, of course.
Exactly.
Yeah, totally. Do you have any other advice for startups, or where they should be getting advice? Either yours or incubators, advisors?
No, I have no advice do not ask me. Like, I am like seriously like a gossip. Like, I can tell you what everybody's talking about or what I'm hearing, but it's like, I could never do some of the serious advising that a lot of these other folks who are much more well equipped than I am do. I do like accelerators. I do feel like there's a lot of value in those if you know what it is that you need from the accelerator and are pretty clear on like finding the right one that can give you what you need. Because I do think they all have their own little like, special sauce there, almost like an investor. Like, there's no problem shopping around for like, we want an investor that helps us and can help us in a way, not just with funding, but also maybe with relationships or other portfolio companies that are, similar, like, what I mean? Just guidance in that regard. I think accelerators aren't necessarily looked at by early stage startups like that. And it's not because they don't want to, it's just I don't think they realize that they could or should. And so I think that there's a lot of wealth of knowledge and there's a lot of great ones that are doing a wonderful job out there. And there's a lot of folks who are like, we're starting to see some of these health tech companies, exit or whatever. And I mean, right now, I hate to say this, but there's a dearth of talent that's looking for work because some of these folks have, unfortunately been laid off. And I'm starting to see a lot of those folks doing some advising and helping, grow the next crop of startups. So it's encouraging to me that they're not leaving the industry. And I think that those are the people, if I were somebody who was looking for an advisor, I'd start to look at, some of the folks that maybe are now looking for work who have experience in health tech, because a few years ago, there weren't very many of them. And, now we have like a class of people who, and I hate that that this has happened, but I think maybe one of the positive things could be that, they are looking to advise these younger crop of startups. And it's like, I hope the younger crops of startups start to look for them too.
Got it. And so I would love to selfishly ask, as if I'm a startup, and by that, I mean this digital health community and podcast that Bimal and I and the team are building and trying to grow. You have your own very successful community and podcast and WTF, sorry. What would your advice be to people like us who want to create content in the digital health space?
Oh my God, do it. Like, do it and make it be yours. Like, I mean, I know my energy is obnoxious to a bunch of people, but you know what? It's what it is. And it's also, I think, like, I get very nice messages from people who like it. And so thank you to everybody who supports me and listens and watches and sends me nice notes. I read everything, and I almost always write back. LinkedIn is my worst. So if you get me on LinkedIn, sometimes it's a bad day, but I appreciate all of that. And so my advice to you guys would be like, yeah, put yourself out there, be yourself. Give it a stab and like try to think about the stuff that you would want to know. You know what I mean? Like, or you would want to ask, or like, what are you curious about? And it's like, the more you can kind of, like, you're in this space. What do you like to read about? What do you what gets you going? And it's like, that's the kind of content like I start to create. Like, I'm a payment model innovation junkie. It's like, I will fall for that story every time. Like, ooh, tell me more. Like, I came from a plan. Of course I'm going to love that. It's like, I love, like, it's like, I feel like my content, I really just follow my curiosity, which is like, I'm in a very lucky place to do that. And I would encourage anybody else who's creating content to do the same thing. It's like, think about the things that you're curious about, the stuff that you like to listen to, maybe even the style of like some of the folks that you like. Like, I mean, I wish I could be like Melba Lara on NPR and have that great voice, or like Kai Rizdal on Marketplace, like, I wish I could channel that, but it's like, I can't. But it's like, those are the things I enjoy. And it's like, what do I enjoy about them? They're genuine. I feel like I know them. They can make jokes. There's candor. There's like sometimes running themes throughout, and you're like, oh, I've listened to this show forever and I get this. And it's like, I think that's the kind of stuff that makes digital content really great.
Cool. Well, I do not find you obnoxious. I don't think any of us do.
Oh my God, thank you. But I'm very high energy.
Okay, no, I love your energy. But I obnoxiously have one last question.
No, you can ask me all the questions you want, but obnoxiously, I've been like the longest guest on your podcast, I'm sure, at this point. So I need to put these answers a lightning round.
Okay. I mean, given all these things that have changed and things that may never change, and your perspective on innovation areas, what do you think, which of those is going to be the next big boom in terms of like number of startups or potential impact on people's health?
Ooh, I've got a couple answers to this. So I think we're going to, I have this crazy conspiracy theory about this like shadow EMR world that's starting to be built alongside the real, like the Cerner and Epic world, where it's like, there's a lot more like startups that are going into that space. If it's like, and even think about some of these primary care companies that have built their own EMR. Like, all of a sudden, it's like I feel like we're starting to see like other EMR possibilities kind of emerge alongside, and then a lot of other data exchange startups that are taking advantage of some of those new privacy rules that have gone into place.
Right.
So that, not privacy rules, I'm sorry, like some of the data sharing rules that have gone into place, and really starting to build out that side. I think that's going to be a space that is going to just pop because of the fact that all of a sudden there's this data that wasn't previously available that we're going to have our little hands on, and we're going to be able to algorithmize until we run out of questions to ask and predictions to make. And so I think that's going to be a space that is really popping. The other thing that I think on that same token, I would like to see this start to become like maybe this is further out, but is like how we're using some of the tech that we've got to better refine the diagnostic process for certain areas of healthcare. So like, how we're all with mental health, right? It's like, how can you refine, how can you get better at doing diagnosis and more quickly getting somebody into the space, like with the data that we're starting to collect about certain things, or even when it comes to like some of these, the pharma innovations around like digital therapeutics that wrap around a pill or whatever. It's like, you have a lot of information now that augments the information that you had in an interesting way. And it's like, can you use some of that to make it easier for somebody to find the right medication faster? Like, or like, get them to a diagnosis with a mental health disorder a little bit quicker, or I don't know. I mean, I think there's a lot of potential there for like having like this front part that helps you not triage or navigate, but it's like, even like, how do you enrich that with technology and use the data in aggregate that we have on a bunch of, let's say, people who are using a remote patient monitoring device, or like all these chronic condition digital health startups that have a lot of information about diabetes and weight and, different types of chronic conditions like that. It's like, if you looked at all of that in aggregate, what could you learn and how could you slice that by population and maybe provide more targeted treatment to women versus men, or people who are in their 30s versus in their 40s? I don't know. I mean, like, there's so many ways to start to look at that data that we never even had before. So I like all of that space that really unlocks the potential for taking all that data that is like really just sitting there and being able to refine it and start to do these things that can really change the way that care is delivered and that patients start to see outcomes. Like, I think that's the way. I love that. I'm so pie in the sky.
No, not at all. I hope we can all be positive. And this past 2 years has been a tremendous change, and we'll see if we can keep up that pace of change, or whether that's good or bad.
I'm excited. Everybody's still excited. I refuse to go down this like, no, the party is not over, not by any means. We are just merely like finding an after hours. That's all I'm saying.
Right, exactly. And digital therapeutics is one of those. I think our next guest is a digital therapeutic startup, but so promising in terms of it's been emerging this past couple of years. But the question for all of these companies comes back again to these business models and policy changes, and how are you going to really make money? Is it going to be from the prescription, the pad, or is it going to be from enrollments, right, through programs with plans and payers? And gosh, I'm really hopeful, like you are, that some of these business revenue model reimbursement things get more supportive or stay as supportive of these innovations. But that's our next guest. Jessica.
How exciting. I'll tune in for that.
Oh gosh, please.
Send him my way if it's a good guest.
Will do. But as far as you're being our guest, Jessica, it's been an absolute pleasure having you on. Thank you. Thank you for catching us all.
Like, I always say I'm the worst at being interviewed because it's like it's like I'm so much more comfortable being on this other side of it. But thank you for the beautiful facilitation of this conversation. I mean, like, these questions were awesome. They were like really, I could not have asked for more carefully curated questions that really let me talk about the things I wanted to talk about. So thank you for putting them together. I really feel like I'm so excited about so many aspects of this space, in case you can't tell. And so I appreciate the fact to just kind of throw these ideas out there, because it's like when I'm interviewing somebody, I try not to put my opinion out there too much. I think it leaks out sometimes, but I try not to. So it's nice to sometimes be able to talk about it. But it's like, man, I'm the worst guest sometimes.
No, you're the perfect guest. You're absolutely carrying it. And I appreciate that. I appreciate your sharing of WTF is going on with health, being a role model for us as a podcast.
Oh, thank you.
Gosh, just continuing to be that pulse on what's new, needed, and interesting in health.
Awesome. Thank you so much. That's so sweet. I really appreciate that. I appreciate you having me on, and like to all of your listeners, keep listening to Chris over here. He's doing a great job. I mean, so fun. So thank you so much for having me. I really appreciate it.
Thank you.
Thanks for listening to this podcast and being a part of this movement. This podcast is brought to you by Persimmon Health, an offering by Leapfrog Technology that's purpose-built to help innovators imagine, build, and scale digital health products. We're passionate about fixing healthcare and have worked on over 50 digital health products. If you want to share your story or want to work together, please shoot an email to hello@persimmonhealth.com. Thank you once again, and I look forward to seeing you on the next podcast.